Welcome to the Yoga for NHS Staff Wellbeing Programme. I'm Paul Fox, the Chief Executive of the Yoga and Healthcare Alliance charity. We've created the Yoga for NHS Staff Wellbeing Programme to really help NHS staff develop some stress management, relaxation, and mitigate risks of burnout tools using yoga practices, which are all evidence-based. And on the program, you learn some breathing practices, some mindfulness practices, some simple yoga postures, which you can do in a chair or on a mat. You learn some relaxation techniques, and we include a little bit of evidence-based approaches to lifestyle medicine, some information and handouts about that. So the reason why we created the Yoga for NHS Staff Wellbeing Programme is because of the crisis that everybody is aware of that is going on in the NHS. And this comes about through a mixture of underfunding, the pressure of growing waiting lists. Pressures on staff mean that there is a persistently high absence rate, and around a quarter of all absences from work are to do with mental health reasons, and the leading cause within those is stress and anxiety. So we hope to tackle that a little bit as well. And of course, there's general dissatisfaction and demoralization that we've seen in the strike action of 2022 and 2023. And NHS staff are voting with their feet. So the staff turnover has been as high as 12.5% in September 2022. And even at the entry-level profession, General Medical Council has found that 1 in 5 GPs in training are at high risk of burnout. So it's very clear there's a problem there, and NHS leaders and commissioners are very keen to do something about that. Although whether they'll dip their hands in their pockets very deeply remains to be seen. So, and if you can retain more staff, if you can promote well-being, and if you can have a happy and motivated staff, then the whole organisation will run more effectively, as well as being better for the staff, also better for patient care. So the Yoga for NHS Staff Wellbeing Programme is based on the Yoga for Health programme, which is the first programme we developed, and it's a social prescribing 10-week lifestyle change programme for NHS patients. I was actually going into particularly primary care settings and talking to GPs, health coaches, social prescribing link workers. And when we explained that we were evidence-based, that we'd been commissioned by West London CCG to create the programme accredited by the NHS through the Personalised Care Institute, and that we had 2 published Westminster University studies showing how effective our programme was in terms of reducing patient stress, anxiety, boosting patient activation, that it was having a multi-level impact by psychosocial. One of the first questions we got back was, that sounds great. Can we have a version of that for staff, please? So we went ahead and did that. And it took us a long time to get accreditation from the Royal College of GPs, but that has now happened. And this Yoga for NHS Staff Wellbeing Programme, you will get a certificate at the end with 6 hours of CPD, continuing professional development, on it from the Royal College of GPs, and that is a really good thing to have. So we're based on the Yoga for Health protocol for patients backed by those 2 Westminster studies I mentioned, but we're also collecting data on our programme for staff, which is a shorter programme of 6 weeks and only 1 hour rather than 10 weeks and 2 hours, although we do offer a 6 weeks level 1 and then a further 6 weeks that you can do if you enjoy this level 1 course. So during 2023, I was responsible for leading programs involving 376 staff. So we've gathered quite a lot of evaluation information on the staff that have done our Yoga for NHS program. We're very proud of this statistic. So getting 91 responses back to a detailed evaluation from staff, and 100% of them would recommend Yoga for NHS to their colleagues. And when we asked them about whether they feel comfortable in sharing some of the breathing techniques that they learn. We see that around about 2/3 are pretty confident about doing that, and 1/3 are not that confident, because folded into this program is an invitation to you, just an invitation, not a requirement, that you become breath ambassadors. And that might mean that you'll end up sharing some of the breathing practices you learn with colleagues that you see who would benefit from it. Maybe they tell you that they're suffering from anxiety or stress or sleeping badly, and you've got a breathing technique that you've experienced on our program that you think could help them. Well, you can do that by teaching it to them directly, just over a coffee somewhere. We're not expecting you to run classes or anything. Or you might just send them a link to one of our breathing videos, so you can signpost them or you can teach them directly. That's a really nice thing for you to be able to offer your colleagues. It's a really nice role to discharge, but we know it's not for everyone. But we think that pretty much everyone will be pretty happy just to signpost them to videos they know they've used and found to be useful for themselves. Let's just watch a little 2-minute video of a couple of staff members who have completed this program.
I found it really enjoyable. It was certainly useful, learning a whole set of new skills. I've never done yoga before. I thought, Paul, you were very good at teaching it, and I've certainly found relaxation useful for my own kind of mental health and well-being.
Yeah, I would agree. I think it's been really valuable and beneficial personally and professionally as well. It's been really useful to have enough time to learn some of the breathing techniques. I have done some yoga previously, but not had enough time to really learn the breathing techniques and how to use that during the exercise. So I found that really useful, and certainly carried on some of the breathing techniques and relaxation at home, which we definitely need.
Absolutely,
yeah. From a health and well-being perspective, I couldn't think of anything better, really. So sort of stress management,
absolutely,
and learning not just to do this in this environment, but taking it home to help you leave work at work.
Just having that time to yourself to just focus on your body, breathing. Yeah. Definitely. Whereas, life, work, it's just so pressured sometimes. Having that moment to just focus on breathing, it's just so important.
We also had some really nice qualitative feedback. So I'll just read through a few of them for you, and you can read them on the screen if you prefer to do that. Please can these sessions be prescribed and made available for all NHS staff who regularly ignore their own needs and prioritise the needs of others. Breathing with awareness helps us to trust that we are okay and the world is okay, despite all we cannot control and all the demands. Thank you for this wonderful course. I now practice deep breathing and stretches in my own time every evening. The course is delivered at a gentle pace, making it accessible to those of us who might not be very fit, but would like to become healthier. Brilliant. I've been wanting to start yoga for a long time, but I've been too intimidated to join a class, and this was perfect. My sleep has improved greatly. The course helped me take some time back for myself at the end of a busy working day, and also helps an ongoing lower back issue I have. I like the hour-long format and the time of day. Perfect for relaxation just before bed. Also, the fact it was only an hour made it feel more achievable in terms of commitment. Being on Zoom worked well too. Thank you very much for watching. We have nearly 500 expert tutors that we've trained that hold NHS accredited qualifications to deliver this program to you, and I really hope that you get a lot out of it when you do it. Thanks again for watching.